Carter, how you doing tonight?
I'm good. How are you?
Good, as family.
They're fine.
Good.
Looks like I just have one patient for you.
All
If you
right.
want to just do report out here in the hallway.
I prefer to do it with the patient.
I just don't really want to go in the room. She's asleep.
All right. I gotcha.
All right. So I have Deborah Ray.
Uh-huh.
She is a 40-year-old female,
All right.
full code.
Okay.
She came in here, I don't know if it was the 13th or the 15th. It looks like she had a seizure at the nursing home. I don't know why she was there. She's been asleep for a while. She doesn't get out of the bed.
Not at all.
No. She's incontinent. Let's see. She had some labs they did earlier. I don't know what the results of those are. They're in the computer. I didn't have a chance to look them up. And she has one IV. It flushes good, but I don't know if it's in her right or left hand. I didn't have to give her anything, so I'm not sure, but you can look it up. And she may have some labs.
I have a couple questions. I think we should do this at the bedside. I'm not sure why she has the IV. What is she getting in the IV? What type of seizure did she have? What are her goals?
Well, I mean, all that's in her care plan. You can look it up.
But you've had her from 7 a.m. till now, and it's after 8. And I'm just coming on this shift, and you've been the one that's hands-on care with her. You could tell me more than what the computer can tell me at this point.
I mean, she's been fine. She's just been resting. She doesn't talk. There's not much I can tell you about her. She doesn't say anything. She doesn't talk.
I really don't want to accept this report from you, and I think I'm going to talk to the charge nurse.
Well, okay. That obviously is not how we give a proper report. And as we all know, evidence-based practice shows that bedside handoff is the best tool to use for patient involvement and satisfaction among our patients, as well as the Joint Commission, which notes that Sbar reporting is the proper method to use when doing our bedside handoff because it improves communication and effectiveness of that communication among caregivers. So we're going to redo the scenario with how a proper bedside report should go.
Hello, Miss Carter. How are you tonight?
I'm good. How are you?
Doing well, thank you.
Looks like I have one patient for you.
Okay.
If you're ready to go in and visit with Miss Ray.
Yes, ma'am. Let's go.
All right. As you can see, Miss Ray is a 40-year-old female. She's a full code. She arrived on 11/13. It looks like she suffered a seizure at her long-term care facility, where she's been a resident for the past 10 years. She was found post-ictal. She is alert and oriented, only to self, and she is nonverbal. She is non-command following. And her right side is weaker than her left. She has a normal sinus rhythm. She's on room air. She is NPO. She gets her feedings through a PEG tube.
Okay.
She gets Gevity 1.5 Q4 hours. She's scheduled for 5 feedings a day at 220 milliliters of feeding and 160 milliliters of flush. She's incontinent with brief. She is on bed rest. Okay. Her skin, she has generalized bruising in her upper extremities. her past medical history. She has MS, seizure disorder, and dementia. She had some testing done. Her urine was positive for bacteremia, and her potassium was low at 3.0. She has a left hand IV, which is 20 gauge.
Okay.
Was flushed and is saline locked. Currently, she is on IV therapy, Q12 hours. She has AM labs consisting of a CBC due. And it looks like her plan is to return to her long-term care facility after 48 hours of IV antibiotics.
Okay.
Do you have any questions for me?
You've answered everything I would have asked you. Thank you, Miss Carter.
Thank you.
Okay, the 3, 2, 1.